Hello, and welcome to episode 2 of Awkward Moms. Again, I am Brittany Daniels, and I hope that you tuned in to my first episode. Well, I kind of explained what started me on this journey. I talked about my journey with my 15-year-old, with him having autism and ADHD, and I kind of discussed some of the obstacles that we've had to face, some of the things that we've had to endure. I'm sure there's a lot of parents that has endured a whole lot than what I've endured, and then there's some that has not endured as much as I have. But I just wanted to first get my story out there and kind of explain why I started this journey. And so, if you're watching episode 2, shoot back to episode 1 and kind of get a refresher or a touch up of why I'm doing this, and kind of learn a little bit more about me and this journey that I'm trying to embark upon. This episode, I kind of want to dive more into what each diagnosis is, what the definition of them are, and what to look for, kind of what the signs and symptoms are, and kind of what to look for with your kids. Like, if you're unsure, if you feel like, well, I think my child may have this, I think my child may have that, kind of diving into what to look for, because a lot of us don't know. And so I've been asked a lot, like, how did you know Gavin had autism? Or how did you know that Gavin had ADHD? And so if you don't know, you don't know, because I didn't know either. So it's just kind of explaining some things to look for and what the definitions are. Before diving into that, I want to shout my sister out. She made my shirt that says autism doesn't come with a manual. It comes with a mom that never gave up. So she has all of the autism merch that you will see me wearing throughout this endeavor is made by my sister. You can look her up on Facebook, Courtney Jones. She makes shirts, hats, yard signs, I think. She makes a lot of stuff, y'all. So if you need some stuff done, look her up again. Her name on Facebook is Courtney Jones. Look her up and she can get this stuff made, and she does do a good job. It is quality work. Now, let's dive into this. So what is autism? Autism is a lifelong, and I wanted to stop on lifelong and reiterate, like I reiterated in my first video, it is a lifelong thing. It does not go away. A child does not grow out of it. I want to kill that narrative. That is not true. It is not something that all of a sudden just dives out of your body and is not there anymore. It is lifelong. You will be 80 years old with autism. You may be able to be functional and be able to live a full life with autism, but it does not go away. And that's a narrative that I really want to kill. I've heard so many parents say, well, she grew out of it, and he outgrew that. And that's not a thing. You don't outgrow it. It's a thing that sticks with you. It stays by you. It does not go away. So like I said, I just really want to kill that narrative. That's not a thing. Again, it's a lifelong neurodevelopmental disability that affects how people interact with and experience the world. So just to kind of give an example, it almost made me cry. My son came to me and told me that, he doesn't really have any friends. And, I guess he kind of feels like I don't really have, that person to kind of, talk to and spend time with or whatever. And it's tough on him because his little brother is very popular. So it was kind of one of those things that I was like I said, I kind of had to walk away a little bit and cry a little bit. But their social cues are just off. They don't know how to be fully social. Even as far as like I've heard a lot of people say, and it's true, they are blunt. What comes up comes out. They are very blunt. And they're not saying anything to hurt your feelings, or they're not saying anything to make you feel away. They just don't know. They just don't know social cues like we know. We know not to tell somebody a certain thing that we know are going to hurt their feelings. Developmentally, they don't know that. They don't know you can't say that. They can be taught not to do that. Now that's a big thing, not just allowing them to do it, but teaching them that, let's not do that. Let's not do that that way, or let's not say that that way. And they can learn that. But again, just expecting them to just know their minds don't work like that. So, developmentally, they don't understand interaction in a average way like your average child. They don't. So, that's one of those things that's kind of a tough thing for having an autistic child, is that social life. They just don't have the skills. But again, that's something that they can be taught. They can be taught how to have the social skills. So, that's autism. So, what is ADHD? It is a chronic condition including attention difficulty, hyperactivity, and impulsiveness. So, the ADHD part of Gavin is an interesting part. The hyperactivity does come out. For example, there may be times where he's very active, as far as like he's running all over the house, he's pacing back and forth, he's talking very fast, and everything is very, that's the ADHD coming out of him. So a lot of times he kind of knows when he's in a place where we call it overstimulated. He kind of knows when he's in a place where I'm kind of overstimulated, like it's a lot going through my mind, it's a lot happening all at one time, and it's a lot for me. So, I kind of taught him to let me know when he's feeling it. Please teach your children to let you know when they feel it, because it's important that they understand that we need to figure out social cues and ways to calm it down some, so they can calm their minds down, because we can't see what's going on in their minds, but sometimes their minds are just, they're going, and it's hard. So, just kind of teaching yourself and understanding what works for your child, and kind of getting them leveled off and calmed down some. That's very important. Also the attention difficulty, the focus. That's what I talked about on last week with me putting him on medication, with his focus being, off. Focus was horrible. The only thing that he would focus on is something that has transportation in it. If you put Cars, the movie Cars, or you put Thomas the Train or something like that on, focus is all the way there. You call him and he's focused. You can call him 50 times and he's not going to answer because he's focused on that. But anything outside of that, he can't focus. So that was a part of the reason why I put him on the Adderall, to help him focus in school, because that's where it comes in really hard, or really it becomes more difficult at school, because you have to focus at school. You have to learn, and you have to have that, you have to give it your full focus. So with that being said, that was a part of the reason why I made that decision, and I explained that last week on me making that decision and why. So that's a part of the reason, because that's a part of ADHD. Also impulsiveness. They do a lot of things that to us may feel like, why would you do that? Like, why would you scream out loud out of nowhere? They can't help it. Like, it's like, I can't explain what they feel, but it's something inside of them that's like, hey, scream out loud. And it's like, ah, and you looking like, why are you screaming? That's ADHD. It's just this thing inside of them that's just this impulsiveness. Not just that, even like I said, sometimes he would run up and down the hallway, and it's like, why are you doing this? It's just this impulse in him that's like, run, and he's running. And it's like, okay, let's calm that down. Let's not run in the house, please. But it's also understanding that they just can't help it. That's how their brains are wired. And they just can't help it. So that kind of explains kind of some things that you see with ADHD. Um, um, what is what's next? What is Asperger Syndrome? It's a developmental disorder affecting ability to effectively socialize and communicate. Um, Autism, I say autism and Asperger syndrome kind of mirror each other in a way. But Asperger is a little bit more, I would say, severe. Asperger's is kind of one of those things where I think I kind of mentioned last week, where I don't know if my son will ever move out from with me, or I don't know if he will be functional on his own. A lot of kids with Asperger's, a lot of times they're not functional on their own. It's like like I said, it mirrors autism, but it's like a deeper form of autism. And it kind of dives into more of a always social. All of this social comes up in some kind of way with all of this, but their social cues are a little bit worse than autism. Most kids with autism, they can find their way with being social, but kids with Asperger's, a lot of times it becomes like that much severe for them to figure out how to find their way. The same with communication. A lot of times when kids have Asperger's, their communication skills are just kind of hard. Um, I'm not gonna say all, but a lot of kids with Asperger's, they just being functional on their own is not a thing. It's not gonna be a real thing. So it's a deeper dive into autism, but again, they mirror each other. They kind of have most of the same signs and symptoms, but it's just a more severe form. Um, so signs of autism, behavioral signs, inappropriate social interaction, which is what I said earlier, is kind of like what comes out. So a lot of times you feel like that's inappropriate to say. They don't know. They don't know that it's inappropriate to say. They don't know that they probably shouldn't say that. That's something that they have to be taught, because they don't understand that that's probably not something that I should say. So as long as they have someone in their life that's teaching them social skills and social cues and that kind of thing, they'll learn that kind of. And I'm going to dive into this as well. ABA therapy. That kind of comes with ABA therapy. They're taught social cues. They're taught social skills. They're taught ways to say things and how to maneuver in life, with their social interaction not being strong. So ABA therapy is a great thing. It's something that I didn't learn about until years after my son had been diagnosed. Although he took some ABA therapy at school, I just was like, oh, okay, he's taking ABA therapy, but I don't have a clue what that is. But if it's gonna help him, cool, let's do it. But I didn't learn later, years later, how much ABA therapy helps autistic kids. It is a great thing. If you can get your child some ABA therapy, get them all of the ABA therapy that you possibly can, because again, it teaches them social skills, it teaches them social cues, it teaches them all of those things that they need to know in order to be a functional adult. Um, Another thing is poor eye contact. I joke with my husband all the time because when he met Gavin, who is my oldest, he met him first before he met my baby boy. And when they first met, we used to joke all the time because Gavin would side eye him. And he could not understand, like, why do he not trust me? Like, why is he side eyeing me? But they don't give good eye contact. If they don't know you, if they don't trust you, they're probably gonna side eye you. And it's hard to get them to give eye contact. They're either looking down or they're looking sideways, but they're never going to give you direct eye contact. That is a big thing with autistic kids. But that's another thing that's taught in ABA therapy, how to give good eye contact. Because in order to prosper in life, you have to give eye contact. You can't keep looking down. You can't keep looking to the side. You have to give direct eye contact. So he's learned how to do that now. But back then, meeting my husband, he had learned the importance of giving eye contact. And sometimes he still struggles with it. And I don't mind reminding him, hey, let's give eye contact. But he's gotten so much better with that. So, like I said, I just feel like as a child, as an autistic child grows up, they learn more things as they go. And as you teach them, they learn more things. And some of that stuff sticks. So, poor eye contact is definitely a thing with kids with autism. They're gonna look down or they're gonna look to the side, but never give you direct eye contact. So that's a sign as well. Compulsive behavior. So working in it, I didn't see a lot of compulsive behavior from my son, but with me working in it and me seeing some of the kids there, um, the compulsive behavior is a major thing. A lot of times when you can say, "Oh yeah, my child threw a tantrum," no, their tantrums are 10 times worse than your average child. Um, and it's something that triggers in their mind that kind of gives them the okay to do something that an average child may not normally do. I've seen a child literally ball up her fist and punch through a glass window and cut up her hand. And it's just one of those things that that's a part of those behaviors that um you kind of have to, again, that's all a part of ABA therapy. You kind of have to watch for with them because some of those behaviors do come out. And a lot of it is, most of it is, I don't get my way. So your average tantrum that a kid may throw is way bigger with an autistic child. Their tantrums are way worse. I can say what I have saw my son do in a tantrum. I have seen him punch a wall. That has happened. So those are some of the things that I would say look for, watch for. That's one of those things that again it's not something that can't be taught not to do. They can be taught, no, we don't do that. No, we don't just let them do that because then they'll become adults being the same person. So, it's our job as their parents to teach them, no, we don't do that. That's not okay. That's not We don't do that kind of stuff. So that's something else that has to be watched for and pay attention to because you may look at it like, well, they're just throwing a tantrum, so I'm gonna just let them throw the tantrum and get. No, they can really hurt themselves. So when going through the compulsive behaviors, really pay attention to your child and talk your child through it because if you just walk away and say, I'm just gonna let you throw that tantrum, again, they can really hurt themselves. I really saw this little girl put her hand through the window and her hand was cut all up. That's a real thing. So that also comes with it. That comes with the territory. That's not something that I've seen in my son much, but I have seen a couple of things where I'm like, that's autism, I know it, but I gotta fix it. So because I gotta make sure we may have had it happen this time, but we can't have this happen again. So just making sure that you correct some of those behaviors. Um, Another thing is repetitive movements. Um, I've seen some kids do this. I've seen them do this. I've seen them do tap their foot. It's like I call it a tick. It's one of those things where a lot of times if they're overstimulated, that's when you see it come out. A couple of Sundays ago, I was watching my son. The way my church is set up is loud. We have drums, we have music, and it's loud at all times. So, although my son grew up in this church and he's used to the noise, he's used to the loudness, he's used to that, there are some moments where I can see that he may not say anything to me, but I know what to look for. And I know that's a tick. So I looked around at him and I saw him doing this. And at first I thought he was kind of just liking the music, but then I was like, no, that's a tick. This music is kind of um overtaking him. It's kind of he's overstimulated. And so if you don't know what you're looking at, I tapped my mom and I told her, you see that? If you don't know what you're looking at, then you don't know. But I know what to look for. So I just kind of hit his leg, and he kind of calmed down a little bit, but eventually it picked back up. But I kind of handled it like, if he doesn't say anything to me, if he doesn't tell me that it's bothering him, or if then I kind of let him go. Because a lot of times I don't think he even notices it, or he even I don't think he notices it or he sees it. To him, it just feels like I'm just kind of rocking back and forth. I hear this loud music, and sometimes I don't do good with loud noises, but I'm okay. And so as long as he doesn't tell me that it's bothering him, then, but I mean, there are also kids who may act out as far as like screaming out loud or, that kind of thing. So if that's happening, then yeah, we probably need to get you out of this situation because it's becoming too much. So again, that's another thing that is all in paying attention to your child and paying attention to um kind of knowing what their behaviors are, what's normal and what's out of the normal. And so I knew him walking back and forth like that. I've been with him long enough to know that's a tick. And it's kind of, I think, and I could be wrong. Please don't quote me on this. I could be wrong, but I think it kind of settles his mind. And once he settles his mind down some, he stops. But I think for that moment while his mind is riled up, it's kind of like, I'm going to rock back and forth until this dies. And then once it dies, because by the end of the service, or by the time my pastor got up to preach, he was done. So it's just, kind of paying attention to your child. Let's see. Something that I've also saw is self-harm. Self-harm is a sign or a symptom. Now, that's something that doesn't show up for every child, because I can't name a child that I've been around and I have a lot of kids surrounding me that have autism, including my own. I've never seen a child inflict harm on themselves in my surrounding, but in my work environment, I have. Some of them do cut themselves. Some of them do gotta take pencils because they're sticking themselves with the pencils. Some of them they do certain things that is self-harm, and they don't know any better. They don't know. I don't know where it comes from. I'm not a doctor, so I'm not gonna tell you, oh, it starts here. I don't know. I don't know where it comes from. I don't know what wires in their brain to tell them to harm themselves. I honestly don't know. But that is a symptom or a sign that may come up. But again, that's not anything that I have experienced personally, but I have seen it happen at my job where a child was harming themselves and they saw it. So that's a sign or a symptom to look for or pay attention to when you have an autistic child. That's another sign or symptom. Developmentally, it's a learning disability. So school doesn't look the same for them. What school may look like for your average child does not look the same for them. Some of the things that your average child may catch on to, they may not catch on to as fast. Also, what I've learned is how they learn is completely different. It's not that they can't learn, because I must tell you, their minds are brilliant. Autistic kids have brilliant minds. I tell my son all the time, he is full of useless information. He's full of information that I will never use in life. Their minds are brilliant. If you talk to my son about a car, he's going to tell you how much that car weighs. He's going to tell you what the car has on it and what each thing does, and you're just sitting there like, I just said I like the car. I don't really need to know any of the information that you're giving me. But their minds are brilliant, and the stuff that they have programmed in their mind is brilliant. So it's not that they're not able to learn, they just learn differently. They don't learn like your average person or your average child, but they're capable of learning. So never let anybody tell you, well, they're not going to be able to learn that. Yes, they can. They can learn. They just learn differently. They don't learn in the same way that we learn. So There may be some learning difficulties, and you may have to get some Gavin has had to do some tutoring. I mean, there's some things that has to come into play with getting them to learn. But again, no, they're not going to learn like your average child. So that's where your IEPs come in. That's where your RTIs come in. That's where your 504 plans come in, because that's set in place to show you how they learn and what they need and what assistance they need in order to learn. So if you have an IEP in place, it has to be followed. My child learns this way, and they need to have this accommodation and this accommodation and this accommodation, because this is how they learn. So an IEP is just a diagram of this is how my child learns, and this is what you need to follow. So that's where all of that comes into play. And like I said, later on, I'm going to dive into the difference between all of those, and you can figure out what's probably going to work for your child, because your child may have a 504 plan right now, and they may need an IEP. So I'll dive into that later on in some later episodes and kind of explain what the difference is in those. They also may have a speech delay. Like I said last week, my son didn't speak until he was 4 or 5. He was 4 or 5. I can't really remember, but there wasn't much speaking. There wasn't. Again, a lot of parents get to experience that first word, and most of the time, the first word is dad. They get to experience that. I didn't. You get to experience being called mama and being irritated with being called all the time. I didn't get to experience that with him. So I got the experience with my baby boy, but with him, I didn't get that experience. I didn't get to, again, like I said last week, I didn't get to turn around and say, well, how was school? And expect him to answer. That didn't happen. So the speech delay is a big thing. Most of the time, if your child has a speech delay, they probably have autism. Not all of the time, because it could be something else. But most of the time, it's probably autism. That's a major thing with autism, having a speech delay. So they may say some things. There may be a few things that you can get out of them, but overall, they're nonverbal. And so I have met a lot of parents. I have met a lot of kids who are nonverbal. And so once you finally get those first few words out of them, I can promise you they never stop. They never stop talking. So, but I must say, I have also seen some kids revert backwards and lose some of their speech. I've also seen that happen. So that's also something that you may have to look to happen with your kids. It doesn't happen to, like I said, every child is not made equal. So I've seen it happen to some kids, but some kids I haven't seen it happen to. Like I said, when my son started talking, he never stopped, ever stopped. So, that's one of those things that you may see sometimes too. Their cognitive skills, intense interest in a limited number of things. Going back to my son, cars is his thing. Cars. Everything is automobiles. Everything cars. He loves transportation in general, but cars, everything cars. I've met some parents who said their kid thing is dinosaurs. They can name all of the dinosaurs, tell you what they do, tell you the sound they make, tell you all of that, and that's what they dive into. Dinosaurs. I've heard automobiles, dinosaurs. My nephew, he's into blocks and that kind of thing. So I mean, he showed me. He came and showed me a diagram that he made, and I was like, "Oh, that's a cute little robot." And he corrected me and told me exactly what the robot was, and I felt dumb. I felt really dumb because I'm like, "Oh, that's a that," and I can't remember what he said it was. I cannot, Nicole. I can't remember what he said it was, but I'm sitting there feeling dumb, like, oh, okay, that's what it is. But that's what's in his, that's how his brain is wired. So they all have their thing that they are attached to, and you cannot detach them from it. I watched my son love cars from age 1 all the way up until this big age. I can't tell you the amount of Hot Wheel cars he has upstairs. It's so many. And he knows exactly what cars he has. And if they go missing, he's going to tell you, hey, I'm missing my red Tesla. And I'm like, well, how do you know? Because you got 17 Tesla. So how do you know you're missing a red Tesla? That's how their brains are wired. So they have like this thing that they have their obsession. So I just named a couple of examples of the things that I know, but I would love to hear from some parents and kind of hear about what's your kids' obsession, because all of them do. They have something that they're obsessed with. So I would love to hear what some obsessions are because they're funny to me. Another thing is they have problems with paying attention. That's also kind of ADHD too. That's why I said that a lot of times if your child has autism, they have ADHD. Not all the time. Not all the time. But a lot of the time those things kind of run hand in hand because they kind of overlap on over each other. Some of the symptoms and signs that you see with autism, you see with ADHD. So paying attention is one of those things that's difficult for them. They fidget a lot, they move around a lot. Sitting them in an environment where they have to sit still, like church, for example, can be difficult because you have to sit still, or and they have a hard time sitting still for even 5 minutes. So that's another one of those things. Seeing them kind of fidget and kind of move around and I mean that can be any child because they just don't like to sit still. But it's levels to it. It's levels to it. So that's another symptom. Um, Psychological, unaware of others' emotions. Um, that kind of dives back into what I said. What comes up comes out. So a lot of times they just don't know. And that's something that I used to tell my parents all the time when they would come and talk to me. They don't know. I know you're feeling like, why would they say that? They just don't know. And until you teach them that that's not okay, they're going to keep doing it. So, what they don't know, they can't help it. They don't know. So, the social skills and the social interaction that we have, they don't understand it. They don't get it. So, they're looking at you like, well, what was wrong with what I said? Like, I don't see an issue with it, but they just don't know. So that's one of those social things. Socially, that's something that you're going to have to teach a lot. Speaking from experience, you're going to have to teach that a lot. You're going to have to correct that a lot. You're going to have to say, hey, let's not say that a lot because they just don't know. They just have no idea. So that's another one of those things that you can kind of prepare to reiterate all of the time. Also common is anxiety, change in voice, sensitive to sound, and the tick. That's kind of going back to what I said earlier. The tick happens, sensitivity to sound. For example, today, my mom blows up balloons and makes like balloon arches and stuff. And she asked my son, can you pop those balloons for me? And I just shook my head, but I let him answer. And he said, no, the noise. I can't do that. So that kind of dives back into also what I said with parents saying, oh, my child grew out of that. You don't grow out of that. You don't grow out of that. So yes, the noise of popping balloons and that kind of thing, he can't take that noise. They're sensitive to sound, and that kind of goes back to tying into what I said about church and the drum beating and the loudness. Sometimes it's overwhelming for him, so he begins to tick. So those are also some things that you kind of see happening, and those are common symptoms of autism. Signs of ADHD or behaviors, aggression. I've seen some of that. My son has had some aggression with me, especially when I became a single mom. I was a single mom for a little while, and I saw some aggression, and I saw a lot of it was him getting older and him feeling like I'm the man of the house now. And so a lot of the aggression was kind of in turn with once they feel like something is out of their control, or they can't control something, the aggression pops out. So a lot of times that's where you see those tantrums. That's where you see that's why I saw the punch in the hole, the wall. He didn't punch a hole in it, but he punched the wall. That's why I saw some of those things. So the aggression, I think I've talked to a lot of parents who have kids with ADHD, and aggression has been a big thing for them because they don't know how to, again, their social skills are not great. So where we can sit down and kind of talk it out, they don't know how to do that. So what happens is they come out aggressively. So aggression is one of those things that you kind of see with ADHD. Fidgeting, again, not being able to sit still. They fidget a lot. They move around a lot. They kind of like play with the fingers or play with the hands, play with the fingers, or just kind of they can't sit still. So fidgeting is also kind of a symptom or a sign or behavior that you see. Hyperactivity, I kind of touched on that. Impulsivity, I've touched on that. Lack of restraint, I touched on that. They don't know how to tell themselves no. They don't know how to tell themselves, I do not need to run up and down this hallway. But you know, they don't, again, what they don't know, they can't help. So it's just paying attention to some of those things that you see happening and trying to do the best you can to teach them to dive that down. Let's calm down. Learning behaviors that work for your child, because every child is not made equally. So learning behaviors that work for your child to teach them how to be functional. Cognitive behaviors, absent-mindedness. I've seen that a lot. A lot of times, having to remind my son of so many things. Did you do this? Did you do that? Did you clean this up? Did you do this? And it's like they can't help it. So having to reiterate things over and over. That's a part of the short attention span. The attention span is this long. I cannot give my son 3 directions. I cannot say, go upstairs, look in your room, and bring me this device. That's 3 directions. He's only going to do one. He's going to go upstairs, stop. What did you say, do? Short attention span. And also just the mind of forgetfulness. Like their attention span is this long. So 10 times out of 10, the reason that he didn't get all of the directions is because he was already walking off before I finished the directions. But because his mind is already saying, she's saying I got to go upstairs, she's saying I got to go upstairs, she's saying I got to go upstairs, he didn't catch the rest of that. So there's also some symptoms that come with that of having to a lot of times reiterate and re-say, also coming with ABA therapy. ABA therapy, I've had the pleasure of being able to sit down and watch it. And they teach them how to take more than one direction. Because I mean, you can't function in life and only take one direction and go with it. A lot of times you're given a lot of directions and you have to be able to follow all of those directions. So that's another thing that goes into ABA therapy. Mood. A lot of times they have anger, anxiety, mood swings, and then all of a sudden just excitement. They can go from depressed to excited just like that. And you're just like, what just happened? Because you were just depressed. Now you're excited. I'm so confused. That's how that minds work. So imagine in your mind, you're depressed and you're in the bed and you're like, oh my God, my life is just, and then all of a sudden you're like, I'm so excited. I just don't, yeah, that's how their minds work. Like they can't control that the way their brains are wired, I'm telling you, is just amazing because they can literally go from, oh, I'm so down to I'm so excited just in a split second. So yeah, just dealing with all of the mood swings that come with them as well can be a lot. Um, the anger comes, the anxiety comes. A lot of kids, including my kid, have an issue with testing anxiety. That's a big thing for my son. Testing anxiety. Although the information is there, when you place the test in front of me, everything's gone. So I've noticed that testing anxiety is a big thing for them as well. And I mean, anybody can. I have testing anxiety, so anyone can have testing anxiety, but it's just kind of bigger for them because they don't know how to dissect it. Signs of Asperger syndrome. Behavior, aggression, fidgeting, compulsive behavior, social isolation, persistent repetition of words or actions. As you can tell, a lot of those things that I named, I also named with autism. That's why I say they kind of mirror each other, but theirs is a little bit more severe. They kind of, it's kind of like take everything that I told you about autism and make it a little bigger. Like they mirror each other, but again, it's a bigger spectrum. It's a wider spectrum, and they kind of where you can kind of teach autistic kids certain things. Kids with Asperger's, you may not be able to teach them, or you may be able to teach them, but there's a different formula for how you teach them. So that's the difference. Um, they have more inability to combine muscle movements, poor coordination, and they also have a tic. So a lot of times you may see, my son was delayed with walking as well. He didn't walk until he was 14 months. But a lot of times kids with Asperger's, they walk way later. So never mind they're not speaking or they're nonverbal, they're not even walking. So a lot of times the muscular moves are a little bit delayed. So that's something else that kind of is a little bit worse than autism. Like I said, my son was delayed as well. He didn't walk until he was 14 months. But kids with Asperger's, it can be even later. So that's something else to look for. They also have anger and anxiety, but they have apprehension. So where kids with autism may be impulsive, they're kind of like, I don't know. Like their mind is saying, I probably don't want to do that. I probably don't. So you have this kid with autism that's out there doing it. But you have this kid with Asperger's that's like, I'm probably not going to do that. I'm not going to participate in that part of it. So that's the difference between the two, where they're kind of apprehensive about going out there and doing things. So that also ties into their social skills. They're not as sociable because they're kind of apprehensive about a lot of stuff. So that's also a sign. And also common is depression, intense interest in a limited number of things. I kind of dived into that with autism with my son with cars. They also have an intense interest in a couple of things, and that's it. They have no interest in anything else. That's it. That's all. Learning disability, they have nightmares, and that was something that I learned myself. That I can remember a parent talking to me, and their child has Asperger's, and I can remember a parent talking to me about some of the nightmares that their child was telling them they were having, and I think the kid was like 4, and she was just saying how he would describe the nightmares in such a way that was like you almost can see it like a movie. And so when I was researching and I saw nightmares, and I was like, oh, that's a sign. And so in my head, as I'm listening to her talk, I just put it to that's just her child, or that's just something that her child is experiencing. I never tied it to Asperger's until I went to researching, and I was like, nightmares. I remember her talking to me about that. So that is a real thing. That is something that your child may experience, the nightmares. Um, and they're also sensitive to sound. Kind of going back to my son today with the balloons. They're also sensitive to sound. So that's another one of the things that kind of ties in with autism. The next thing I wanted to dive into, and I'm about to wrap this up really soon, is early detection is key. Early detection is key. I found out my son was autistic at 2, but I oftentimes think about if I didn't find out so early, the trials and tribulations that my child would have had to face because I didn't know what was wrong with him. So the thing is, if you knock this thing out early, you know what you're trying to fix. But if you walk around in denial, or you walk around like my child is fine, everything's okay, he'll get past this, she'll do better, you're doing a disservice to your child. So it's important to make sure that you get that early detection. As early as I've seen a parent get their child diagnosed as early as 2. I mean, as 1. I'm sorry. So you kind of know, because a lot of things, by 6 months, a child is saying that, and they dad you to death. But if your child is not doing the things that you may have seen other kids do, question it. Now, it may not be autism, it may not be Asperger's, it may not be ADHD, it may not be any of these things. But it's nothing wrong with checking it out just to be sure, some reassurance for your mind, so you can sleep well at night knowing that your child is okay. Early detection is key. Make sure as early as you possibly can. Never let anybody tell you your child is too young, because I've heard that too. Your child is not too young. Get what you need for your child at the earliest age that you possibly can, because that gives you time to figure everything out for your child to make them a successful child. Like I said, had I not died on this at 2, he wouldn't be as far as he has. Wouldn't have came as far as he came. So two things that I'm gonna always push: that's early detection and advocate. Those 2 things are key, and they're very important. As early as possible. Know what's going on with your child so you can know what you need to tackle, and you can know what you need to work on in order to get your child all of the help that they possibly need. Early detection and advocating, all the same thing. They're on the same thing. So make sure that you do that. Before I leave, because I'm about to wrap this up, before I leave, I wanted to give some stats really quick. So, 1 in 36 children have autism. That's the stat as of now. I checked it a year ago, and it was 1 in 42. So that lets you know that within a year's time, this thing is like getting narrower and narrower. And no, I'm not going to sit here and tell you, oh, autism comes from this. So nobody knows where autism comes from. No one knows. And I'm sure that they're in the labs trying to figure out where it comes from, all of that. But no one knows where it comes from. I feel like it's one of those things that has always been around. We just didn't have a name for it. So, yeah, it's a real thing, and it's something that is attacking the kids left and right. And so, all you can really do is do what you have to do as a parent to make sure that your child can be as successful as they possibly can. That comes with advocating. So, yeah. What I also found interesting is 1 in 42 boys have autism, but 1 in 189 girls have autism. And what's crazy is, when I was working at the autism school, I sat and I looked. Most of them were boys. There were a few girls, but most of them were boys. I don't know where it comes from. And of course, me having an autistic son, I want to know where it comes from, and where has it started, and what has spiked this, like, and why the boys. I would love to know, but no one knows where it came from. And listen, when we figure it out, yes, I want to know. I want to know where it came from. I want to know what we can do to stop this, because yes, it's taking over. And it's one of those things where, with us not knowing where it comes from, all we can really do is just test our kids and do what we can to get them the help that they need. But when I read that stat, I was like, oh, wow. So that's a broad difference between boys and girls. A major difference. So that's a real stat. And yeah, I just wanted to kind of give stats on where autism is right now. And I often check the stat to see where it is, to see if it's still the same or if it's changed. I would love to see the number get higher. I would love to see autism kind of die down some. I would love to see it because help is hard to find. ABA therapy is one of those things where you are lucky if you get it because it's so hard to find. A lot of the people in the school systems are overworked, and it's hard for them to pay attention to certain things. That's where you advocating comes in because it's hard because teachers are so bogged down with so much paperwork and so many things that they have to work on as a teacher. They have 30 kids in their classroom, but just think about it, 30 kids in their classroom, but 10 of them have autism. So how can they pay that much attention to your child when 9 more have the same condition that your child has? Plus, they have to pay attention to the rest of the kids. So it's just tough. It's hard. It's really hard, and I would love for that number. I would love to see that number get better, but again, we don't know where it comes from. So yeah, that just touched me, y'all. I'm sorry, but yeah, it's hard. So for me, right before I wrap this up, I just want to share that I know that I said last week that I would love for parents to come over and tell their story, but I needed to fix that. I actually would love for parents all over the world to come on and tell their story. We can set up a Zoom call. We can do a duo call. We can do whatever. But I want people to come on and tell their story. I don't want to be the only person telling my story because everybody's story is different. Everybody's story is different. Everybody has experienced stuff different. I want to learn from you as you learn from me. I want to make sure that we come together and we look out for each other. So I would love, please reach out to me. At the end of this video, just like I did the last video, I'm going to put my information so you can reach out to me. Please reach out to me, and I would love to hear your story. Also, therapists. I would love to hear from some therapists that can come in and give some more information because all I have is the research that I've did. But if you work in it, you can kind of come in and help from a therapist standpoint. So I would love for some therapists to come on. I would love for if in BCBA, love it because you can thoroughly teach ABA therapy. That I just would love for it. I just need a village to come and help me. Let's do this thing so we can make this bigger for parents. So reach out to me again. My information is going to be at the end of this video. Parents, therapists, um, RBTs. If, please reach out to me so we can put this thing together for all of the parents that are needing help. Gavin, can you come here, please? Y'all have heard me talk about him. He doesn't want to be on the camera, but I'm going to see if I can make him come. Bear with me. So y'all can see the person that you've been hearing me talk about. Can you come to the camera and just wave your hand at least, please? These people have to hear me speak about you. Can they see your face? This way, over here. Bend down. Can you at least wave and tell them hi? This is Gavin. He's my inspiration for starting this podcast. So I wanted to introduce you guys to him and let you guys know that he's my kid that has autism and ADHD. But as you can see, he's very well functional. And at certain points, yes, at certain points, but you're functional. And yeah. And also, just kind of point out, I talked about it earlier. Can we see how his eyes are not giving direct eye contact? There it is. So, thank you guys for tuning in, and I'm excited to dive into episode 3. But this is gonna wrap up episode 2. Thank you guys. Bye bye.